Great. Good morning, everyone, for joining us on this Monday, October 25th media briefing. We'll get right into it, and I will pass it along to Nicole Dupuy, our CEO.
Good morning, everyone, and thank you for joining us today. Last Friday, the Ontario government made an announcement outlining the approach to lifting public health measures related to COVID-19. These steps begin today with the lifting of capacity limits in settings where proof of vaccination is required. This includes restaurants, indoor sports and recreation facilities such as gyms, gaming establishments, and indoor meeting and event spaces. Other settings have the choice to lift capacity limits if they choose to require proof of vaccination. These locations include personal care services and indoor areas of museums, amusement parks, marinas, and clubhouses. Locations offering wedding, funeral, or religious services, rites, or ceremonies can also opt to implement proof of vaccination to lift these capacity limits. Businesses are reminded that they can download the Verify Ontario app to aid in screening guests for their proof of vaccination. The next step toward reopening is planned to take effect on November 15th, when capacity limits will be lifted in other high-risk settings where proof of vaccination is required and needed. This includes food or drink businesses with dance facilities such as nightclubs and at wedding receptions held at meeting or event spaces. The government is moving forward with these steps based on positive trends in our provincial case counts and impacts on our healthcare system, including hospitalizations and ICU capacity. Ontario allows each public health unit to enact their own restrictions locally should epidemiological data show a cause for concern. In Windsor-Essex, we are happy to see our key indicators trending downwards, and will continue to monitor these numbers closely as the health of our community is our top priority. We would like to remind Windsor-Essex residents that other public health guidelines are still in place and should be followed, even as other restrictions are lifted. Continue to wear face coverings, maintain 2 meters of physical distance, frequently hand wash, monitor for symptoms, and stay home if you are feeling unwell. The full list of locations impacted by the provincial announcement, along with future steps to lift restrictions, can be found on our website at wechew.org under What's New. Plan to safely reopen Ontario and manage COVID-19 for the long term is also available. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning. With those looser restrictions coming into effect, I'm wondering what, if anything, changes for public health in terms of enforcement or strategy around compliance.
As far as enforcement goes, nothing really changes too much. Obviously, with capacity limits lifted in certain settings, it's one less thing that we need to monitor. Is challenging to determine based on square footage, what is the appropriate capacity limit. So, that's one less thing that we'll have to monitor. But, our plan will remain the same. We'll be proactively out and proactively educated and proactively working with our businesses and community.
Thank you very much. And I know that the health unit reports the rate of COVID-19 cases by age group and vaccine status, but is there a reason why when we have new cases and deaths associated with COVID, that the vaccination status of those people isn't reported at the same time?
So I'm sorry, just that your question is, why aren't we reporting vaccination status related when we have a death?
A death or new cases?
So we do report, as far as our total cases, the number that are vaccinated and unvaccinated on our website. When we report deaths, we do keep it limited in order to, at the time, in order to protect the privacy of the individuals. However, we do report that information more in an aggregate when we look at all of our total data.
Okay, thank you.
Any question? Go ahead.
Yeah, Mike, if I could supplement that. I recognize that it's challenging because there are certain data elements that people might want to know about. But the balancing act for the Public Health Service is to try to protect the privacy as best as we can of the people who are sick or who have died. And so, what data elements to disclose and what not to disclose is always a judgment call. The second item is that we don't always know the vaccination status of someone who has an individual case or who has died. And so it's not always easy to ascertain what the vaccination status that particular individual might be. We know the vaccination status overall of the population, which we can estimate based on data, but that individual data element can be sometimes very difficult to obtain.
Thank you.
Any questions?
Oh, I'm sorry. I know that Mike was having microphone issues this morning, so we will move on to any questions from Windsor Star.
Yes, good morning, Nicole. Good morning, Doctor. You mentioned that individual health units can enact additional restrictions as the province continues to open up if they deem it necessary. Perhaps this question is for you, Doctor. Although Windsor-Essex still has a relatively high case rate compared to other health unit regions, why are you comfortable opening up things now, the way that the province is stepping forward?
Well, my colleagues at the province try to make the best decisions they can based on the data that's available to them. And the province's current direction is to reduce capacity or eliminate capacity limits. I think that from a local health perspective, Ontario is divided into 34 autonomous health districts, and the legislature had contemplated the fact that local public health measures may need to be modified based on the local circumstances. So I think at this point, what we do at Windsor-Essex is to monitor the situation, monitor the case count, monitor the burden of COVID-19 on the community, and then formulate a response based on that. So at this point, our main goal is monitoring to see what the effect of these relaxations will be in the Windsor-Essex community.
Thank you.
Any questions from AM 800?
Nicole, I just saw a tweet from the health unit in regards to the pop-up vaccination that's taking place later today. Just overall, how has attendance been? I know we touched on this before, but are people still coming out to these?
We have touched on this, and I wish I had better predictors of which events would be really successful over those that maybe are marginally successful. But the partners that we work with do report back to let us know, the numbers and as well as how many are first doses versus second. And I know the past few events that we've hosted were pretty successful. So, a fairly, what I would consider for a mobile or pop-up event, fairly large number of individuals coming out to get their vaccine. So, so it's still a great strategy, and it's still working. And, we're not deterred by the events where we only have one or two or none, because, then the next day we have an event that's over, has more than, 50 people attend. So I know the recent events have been quite well attended.
Nicole, I'm not sure if this question is more for Windsor Regional because they, I believe, operate the main site there at the former Sears building, but has there been discussions yet on how long that center will stay up and running?
So Windsor Regional is the main operator, but we are in partnership, in the mass vaccination site. And as you know, Rob, we do have additional populations that are still to be vaccinated, particular, youth. And while we will continue to work with primary care to ensure that that's an option for parents who are looking to get their children vaccinated, we are preparing for 5 to 11 doses, and the mass vaccination site locally will be a big part of that. So, at this point, it'll be open as long as we need it, and it will be needed at least in the next few months.
Thank you.
Any questions from CTV?
Yes, good morning. Given that the COVID case rate rose dramatically after Halloween last year, do you have concerns this year about Halloween or do you feel that the region is in a better place to handle it given the key indicators and vaccination rate?
Well, I think that obviously we look at history and we look at previous events to help guide us on what potential risks are in the future. And Halloween was a significant event in the health district. However, this year we do have vaccine, which we didn't have last year. But that's also modulated by the fact that we're now seeing most of our cases in young people, which is a trend that we're also concerned about. At this point, I think that we try to encourage people and we try to encourage the community to have as safe as possible Halloween. And it's really a group of events that precede Halloween. And we continue to monitor the situation and formulate public health policy based on the burden of disease. We are concerned, and we will continue to monitor in the time period after Halloween to evaluate what the actual number of cases are and the number of people that are put in self-isolation as a result of those case exposures.
Thank you. And will the health unit be releasing recommendations for the community about Halloween this year?
Yeah, I can start. Yeah, we do plan to, share our local guidance, which, related to Halloween, and will reflect most of the points that Dr. Necessary just said, and will certainly align with recommendations provincially as well. I don't know if you want to add anything, Dr. Necessary.
Yeah, I think that the health unit gave a fulsome group of recommendations in the past, and I think we'll continue to do that. I could ask, I don't know if it's up on the web page, but it'll be up on the web page before Halloween to give people guidance. The issue still remains the same, which is to try to maintain social distancing, wear a mask if you're indoors, wear a mask if you can't remain consistently 2 meters away from somebody else, stay home if you're sick, especially at Halloween. Don't let your kids participate in Halloween and do trick-or-treating if they're unwell. At the end of the day, COVID-19 is a disease that's transmitted by respiratory particles from people who are close to each other. And to the extent that we can try to minimize the burden or minimize the number of cases associated with Halloween, I think that would be an important step. So we would ask the community to remain vigilant during the Halloween season to prevent the transmission of COVID-19.
Okay, thank you.
Do we have any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn this morning?
Yes, I wanted to ask you how you feel about the province basically saying that by March they may lift the vaccine mandates and the masking mandates early in the new year. It's a little ways out, and I can understand politically why the government might want to do this. But do you have any concerns about announcing an end to those mandates from a public health perspective?
Well, I think that we're all in this pandemic together. It has affected every household and every family and every business and every school and every institution. I think that it's only reasonable that the broader community would like dialogue and potentially some guidance and a framework to move forward. I personally am very cautious, and so it's very. There's one thing we've learned from the pandemic is it's an unpredictable illness and an unpredictable disease on a population health level. I think that the province it's okay for the province to promulgate some aspirational goals related to where we think we'll be in the pandemic in March. But I think also everyone recognizes that based on the data that we have, that we may have to modify the course based on the experiences of moving forward. So I'm comfortable with promulgating a timeline and a framework, but I'm also cautious and would say that we should continue to monitor the situation, and if circumstances change, then to modify the plan moving forward as well. Sorry for that long-winded answer, but I think it requires a more circumspect response.
I think you're right. I think it does. And one thing I wanted to, one thing I wondered when that came down was whether there were any concerns that people would say, oh, okay, you know, we're going to end all of this in March, so maybe it's not so serious. Any thoughts like that?
Well, I think that the data would suggest that COVID-19 is serious and continues to be serious. I think in Windsor-Essex, about 450 people have died of COVID-19. I think it's in the thousands that have been infected by it. This year, there are 300 class cohorts or 300 classes of young people who have been excluded from school for some period of time because of COVID-19. So I think that the community generally recognizes that COVID-19 is a serious problem. I don't. As public health officials, we want people to remain vigilant moving forward, and if we get higher vaccination rates, I remain optimistic that we'll have better control of COVID-19 as we move into the winter. I think one of the things to think of too is how can we increase the vaccination rate of young people who are eligible for the vaccine, and I'm hopeful that at some point in time we'll have vaccination for younger school-age children, that is people under the age of 12. I think the one thing that all community members can do is they can discuss the vaccination of young people, and for parents to contemplate contemplate the vaccination of their young child moving forward when the vaccine is eligible for that age group.
Thank you.
Any additional questions from Windsor Star?
No, thank you.
Additional questions from AM 800?
Nicole, just in regards to what we talked about a couple of weeks ago in regards to the language towards staff and the harassment of your staff, has it improved over the last 2 weeks since you made that call? Has it got better, worse? Any comments there?
Yeah, I would say that it has improved. You know, I would say overall it has improved. You know, we're still following all our practices, and but I would say overall it has improved. Yeah.
Thank you.
And any follow-up questions from CTV?
No, thank you.
All right, everybody, thank you very much for joining us this morning. We will meet again on Wednesday, October the 27th. Have a great day.
All right. All the best.
Thank you.
Thank you.
Thank you.